May is Mental Health Awareness Month, and we here at WBAL TV have launched a major public awareness campaign. It's called Maryland Peace of Mind, and it's aimed at helping us normalize the conversations around mental health. And this morning we want to welcome Dr. Jill Rockbeisel, who is chair of the Department of Psychiatry at the University Maryland School of Medicine, to talk more about mental health and the effects of the pandemic. Good morning, and thank you so much for joining us.
Good morning. Thank you for having me.
Doctor, we know that people are dealing with an increase in stress and anxiety and depression, but what are you finding are the main causes of this throughout the pandemic?
So I think those causes have changed as time has passed. I mean, initially it was intense fear about getting infected, getting very sick, losing loved ones, dying. Much of the stress had been related to school closures, working at home. We saw an increase in actually child abuse and domestic violence during the initial and middle phases of the pandemic. Now I think the stress is sustained, and it has a lot to do with it's impacting mostly young women, mothers and children, and it has to do with getting the vaccine, getting access, some hesitancy around what that impact might be, and then who's vaccinated, how to maintain safety, and around for you and your family. So we see the mental health and the physical issues continuing into the future, even though things are starting to open back up again.
Well, and that's the thing. The opening back up is not a panacea for everything. We're likely still to see more businesses close, so people are going to be losing their livelihoods. It's not going to just magically be okay now that things are opening up. And for families and individuals, their situations aren't magically going to get better. People are getting divorced through the pandemic. They have lost loved ones because of COVID or some other situations that have happened, and that grief is very real.
Absolutely. The ongoing stress and worry of all of these things that you mentioned, excuse me, is absolutely wearing both on your mental health and your physical health. Even as things open up and we anticipate children going back to school, the worries and concerns of how that will be managed is paramount. So you really have to think forward and start to address taking care of the things that are causing that. The isolation that we've experienced has such an impact, again, on young people the most. Socialization, having contact with friends, really critical for those developmental milestones of children, adolescents, college students, getting connected, feeling good, and being able to move forward.
And that's the thing I don't think talk about nearly enough is the impact on those college kids not being able to have the normal experiences, or high school kids. Little kids are a little more adjustable, but they're dealing with their own set of problems. So you're seeing it across the gamut. We want to talk about how people can get help, because by the time someone actually reaches out for help, they need it, and they need it now.
That is right. The first thing is to be aware for yourself, for your family, and those around you, of those that might be suffering. Suicide is also going up dramatically, both in children, adolescents, and in adults. So if you notice that you yourself, your family member, your friend is struggling, absolutely get help immediately. And that can start with just reaching out to the pediatrician or your primary care doctor, who's often connected in with the mental health system. There's also national numbers that you can call for suicide, domestic violence, child abuse. So those types of things, there's national numbers available to connect immediately. Even through the school system, even in the summer, most school systems have some form of mental health network. And so if your children, again, middle school, high school, college, they all have mental health systems, reach out to be directed on where to get that care.
All right, Doctor, thank you so much. Really great information for us this morning. Take care.
Thank you very much for having me.
You are so welcome. And there is a growing list of mental health resources on WBALTV.com and the mobile app for immediate emergency mental health assistance. Always call 911.